Lots of questions about the cost of dental implants, getting new teeth with implants. So what affects the cost?
Yeah, there's about 8 things that affect the cost of dental implants. Actually, I have a cheat sheet here to go over those with you.
Okay.
First one is the number of doctors that are involved in your care. Traditionally, you'd go between at least 2, sometimes 3 offices. Each one of those offices is going to send you a separate bill. By keeping everything in-house and all of our doctors in one location, we're able to minimize that expense.
So it's kind of one doctor or one office, one fee.
One office, one fee, multiple specialists treating you in that one office.
Okay.
Yep.
What else affects the cost?
Second one is the type of implants chosen. There's a lot of cheap implants on the market. We're using what's known as the gold standard in dental implants, and so you're getting a quality product. When we do this, we want to make sure this lasts for the rest of your life. By going to a location as the cheaper implants, you could expect to have these redone in the future.
It's not that much cheaper, right?
Not that much cheaper. Not worth skimping on one of the most important parts of the procedure, which is the metal implant going into your bone.
Okay, good.
Yep. The next thing that affects the cost is a big lab bill. Who is it that is actually making your teeth at these other centers? A lot of times it's an outsourced third-party lab, and the majority, according to studies, that's how it's still done. And so that cost gets pushed back onto the patient, increases the cost of the procedure. By keeping that in-house, we can lower the cost.
So at Reva Dental Implant Centers, I mean, is this part of the business plan, like do it all right there? So having it all right there.
Having it all right there is what allows us to do this. Everything in-house, the doctors in-house, it allows us to accomplish that. Next thing that affects the cost is insurance. Insurance, max payout is usually $1,000 to $2,000, so it doesn't cover this procedure. What we do in our centers is work with the patient to allow them access to financing. Most
people finance this?
Most people that get this done, it's all through financing. And there's some great options out there. Allows for very low monthly payments, makes it feasible for most people to get this done.
So you have to have okay credit though.
You have to have okay credit, or sometimes these groups will let you co-sign, and we'll help with that process.
So you kind of set that up in the office.
Yep, we'll set that up and walk you through it. But credit or a good co-signer will allow most anyone to get this done.
What about Medicare and Medicaid?
Unfortunately, they don't cover the procedure either, which is why most patients will finance it and allow them to still get it done.
Okay.
Yep.
What else affects the cost?
Next thing that affects the cost is what type of teeth they're actually getting. A lot of these ads that patients see, it's not a fixed set of teeth. It's a snap-in denture. They'll see a very low advertised price that can be a bit of a bait and switch. When they get a little further down the road, they realize this is just an acrylic set of snap-in teeth, which I would not recommend to anyone I cared about.
So what the teeth are made of
Yep.
affects the cost.
That's exactly right.
So what do you use? I mean, like what's considered the best material for?
Yep. Gold standard for this procedure is a zirconia material that's as durable or more durable than our natural teeth, has the best aesthetics or the best look.
Okay.
A set of acrylic teeth, it's really just a piece of plastic. It breaks often, lots of expenses needed to continually fix it, and it doesn't last for the rest of patients' lives. We want to give them something that lasts.
Okay.
Next thing that affects the cost is the extent of surgery. Some folks need more done, more extractions, more bone grafting, more procedures done in order to get the same result. And we don't really know that until we sit down with the patient and review their scan. And then the last thing is the experience of the surgeon and the provider, giving you your care. It's been shown time and time again, less experience leads to poorer outcomes. And I would also argue that less experience leads to more expensive outcomes. When you have to have something done twice, it's going to cost a little more than doing it right the first time.
Now, is this true that when things are difficult, general dentists that even do dental implants send them to the oral surgeon?
That's very common. And
this is what you do, right? I mean, oral surgeons, this is
our specialty. This is what we have the extra training to do. This is what we spend our career doing. And so it's most common that the referrals it's most common that a general dentist will refer to the oral surgeon for the bone grafting, for the implants, for the extractions. And so that's why when a patient gives us a call and asks us over the phone, how much is this procedure going to cost me? We don't know. We have to sit down with the patient. We have to review what they need and what their options are. And at that time, we'll give them a quote, give them a price. They can shop it all over town. But we don't really know until we sit down with that patient and see exactly what they need.
And I'll put you on the spot. You are about 20-30% less than the national average for this exact same procedure.
That's right. We really pride ourselves in being the best, but also affordable, allowing more patients to move forward with it. So about 30% less is what we see compared to other providers.